Hello, my name is Julie Wickel, and I am one of the doctors here at Claws&Paws Veterinary Hospital. Today, I would like to share with you and demonstrate the importance of a physical examination. Dogs and cats age much faster than people do. One common misconception is that for every year a dog lives, that it's actually 7 years of age. However, it's a little bit different than that. By the time your dog or cat is 1 year of age, that's roughly equivalent to 15 years of a human age. Then by the second year, you can consider them to be 24 to 25 years old. After that, add 4 to 5 years for each calendar year. That means that small dogs and cats, by the time they're 6 years of age, are considered to be middle age. Large breed dogs will age faster, and they are considered to be senior citizens. Just like with people, the older we get, the more health problems that we can have. So you can see the importance of a 6-month physical examination. Going a year or longer is roughly equivalent to us going 5 years without seeing our doctor. When you come in for your physical exam, your doctor will ask you varied questions, such as what diet is your pet on, any ongoing problems, what medications and supplements that you are giving them. Then, based upon your history and the physical exam, you and your doctor will discuss any potential treatment plans or any lifestyle changes that may be needed. So why do a physical exam? After all, you can look at your pet's hair coat, inside the ear, at your pet's eyes. However, the physical exam is much more important and more involved than that. The value of a physical exam is obvious when your pet is showing signs of illness. But what about when your pet appears to be healthy? Not all diseases will cause your pets to stop eating or lose weight. Some diseases will actually cause your pet to be more active. Many pet owners will attribute their dog slowing down to an aging process. However, sometimes it can be a disease that with appropriate treatment can be corrected. Is that lump on your pet's skin serious? Do you really want to wait until a heart murmur causes congestive heart failure, or is that a tooth infection that could turn into an abscessed tooth? Do you really know if your pet is healthy? Because our pets can't talk, it makes it more difficult for us to discern, do we have health issues or not? Your pets depend on you, your observation, and your health care to keep them healthy. So you can see why the physical exam every 6 months is so important to the health of your pet. I am now going to demonstrate a physical exam for you. Today we have Robin and her dog Gus, and they're going to help me demonstrate the physical exam for you. Now, not every doctor will do the physical exam in the same order that I am, but we all look at the same things. First thing I start with is I just do the eyes, and then I look inside the mouth, and what I'm looking at is how much tartar is on the teeth. And I open up the mouth and look in the back and make sure we don't have any abnormalities. So Gus has a little bit of tartar on his teeth, and we'll see about cleaning them in 6 months. All right, let's see if we can get Gus to stand, Robin.
There you go, buddy. Come on.
All right. Next thing that I do is I listen to the heart and the lungs. And what I'm listening for is I'm getting a heart rate. Make sure it's not too fast or too slow. I also listen to the heart for any arrhythmias, where the rhythm is not what it should be. And also, do we have any heart murmurs? And then I listen to the lungs for any abnormal noise. Heart and lungs sound good. Then while Gus is standing, I'll palpate his abdomen. And this is to palpate the organs that are inside there, and also for any abnormal masses. And he feels fine. Then while I'm back here, breeds like Gus tend to have problems with their hips. And so what I do is I go ahead and move the hips and the knees around, make sure I don't feel any cracking or popping that shouldn't be there. All right. And then we're going to look at his skin. And what I'm looking for are, do we have any abnormal patterns of hair loss? Are there any lesions on the skin? Okay, let's get him to lay down.
Down. Lay down.
Good boy. And also what I'm doing, looking for fleas. And I palpate the skin to make sure we don't have any lumps or bumps that he shouldn't have there. Then we go up to the front, and I palpate Gus's lymph nodes to make sure everything's symmetrical, There are no enlargements that shouldn't be there. Good boy, sweetheart. Alright, then I end up back at the eyes and the ears, which is where I started. It's okay, baby. Here, what's that, Gus? Oh. First, we're going to look at his ears. And what I'm looking at is the dog's ear canal is vertical and then horizontal. So what I'm doing is I'm looking deep in the canal to his eardrum, checking for any extra wax, any signs of infection. Good boy. You listen. Oh, thank you. We're going to look at his other ear. Good boy, sweetheart. Ears are nice and clean. Now we're going to take a look at those pretty eyes of yours. Good boy. That's a good baby. Now on my eye exam, I look at the external part of the eye first. The cornea, the sclera, the pupil. Down you go, Gus.
Yeah.
And then secondly, I use this instrument, and this is to look at the back of his eye, his optic nerve and his retina. And there's a lot of things you can tell about potential for systemic disease by looking back here. All right, good boy. Okay, so that is our physical exam. What I've done, good boy, too many treats. What I've done is look inside the mouth, look deep inside the eyes, deep inside the ears, listen to the heart and lungs, palpate our abdomen, move our legs around, take a good thorough look at the skin, feel for any lumps or bumps, and then I get to tell Robin she's got a nice, happy, and healthy pet.